My dear students, clear, correct, and concise. That is how we shall deal with the tips for MD Path students. Tips shall mean topics in pathology for students or techniques in pathology for students. Whatsoever, these are all a difficult list of questions for the students to answer. And look at the screen. You have got the electron microscopy. From this, the question shall be electron microscopy as such, applications of electron microscopy, transmission electron microscopy, scanning electron microscope, the applications of electron microscopy in renal lesions, in dermatopathology, or in other conditions as well. So this is a little difficult, and I would like you people to stay put with me for the next 20 to 30 minutes or so. As usual, we shall be having a panel of subheadings. I would like you people to kindly stare at these subheadings and get them fixed in your mind. This, of course, is somebody whom you people can identify. This is projected intentionally to impress upon you people the stages that we had come across in the development of microscopy. Forget the text that is over here, and that is the reference. The students who are interested can go back to this reference, and that is the source of it. My main intention here is the difference between the compound microscope and the electron microscope. The compound microscope is something that we are using routinely, and the electron microscope is something that we are going to deal with. There is a light source, a condenser, then you have got the specimen, there is an objective, and you find that an image is getting formed, and this goes on to the eyepiece, and from where it goes to the human eye and the brain, which is supposed to be the computer. This is the light microscopy, or sometimes nowadays we find that even this is getting attached to the computer. The electron microscope, on the contrary, I used to describe this to the students as an inverted light microscope. You are going to see the pictures, it will become clear, but the text we shall be missing. Hence, follow this. There is an electric gun. Electric gun means it sprays and it separates the electrons. There is electromagnetic condenser, which concentrates on the specimen. And this is passed on to the electromagnetic objective. There is an intermediate image, and then finally you get a projector, and the image is fixed onto the screen and recorded. This is one. So these two I would like you people to kindly compare rather than memorizing, and see how much you people can recollect. This is it. So for a comparison, I had mentioned it. Actually, as I told you, this light microscope, it should have been the other way around. You find that there is a light source. It can be artificial illumination or a mirror. And then there will be the condenser lens. You have got a specimen over here. And there are the objectives. And finally, it goes to the eye, from where the image is getting formed. In a case of a TEM, a transmission electron microscope, you find that the beam of electrons happens to be the source of energy. And it breaks up into multiple electrons, which are well controlled by the cathode. And this helps in the focusing of these rays. It is not the objective lens that we are seeing in a light microscope, but these condensers, which are of extreme importance, and they help in the focusing of the beam of electrons onto the stage, which gets projected onto a detector. and that is being recorded. So this one you people should be having. Even now, if it is difficult, you need not bother about it. So the magnetic fields that are helping us to focus the electron lenses. Please remember this. Always I start with the history. Now, such an equipment, you find that it is so huge that it cannot be done away with. The credit first goes to Hans Busch. He was a German physicist who identified the electromagnetic lens, from which a couple of people, R.A.T.S and Maxwell, one is a physicist, another is a electrical engineer, who had identified the electron microscope. And it was called the proton electron microscope, which could magnify things up to 400 times. This was the prototype of the electron microscope. Subsequently, you find that Siemens company you people would have heard of. It handles a lot of these gadgets and obtains the patency for them. And what they did was they obtained the patency and asked this particular person to develop it further. And finally, this employee, Lübke of Siemens and Halske, they prototyped the electron microscope. All said and done, this is the original electron microscope that was devised by R.A.T.S and Maxwell. Please do have it in mind. So ultimately you find, instead of light, there is going to be an electron beam that is falling on the object. If it is going to be a scanning electron microscope, it will get reflected from the surface itself. If it is going to be a transmission electron microscope, it will traverse. That is why the word transmission. And each of the components within the tissue will get reflected in different ways so that they are being recorded different wavelengths. So this is the basic theory. The entire list of it, if you people are interested, it is from Wikipedia. You people can go into it. Following which, Siemens was a person who doesn't give up that easily. Helmut R.A.T.S, he is a brother of R.A.T.S originally, and he contributed Manfred in 1937 from US. And currently, the electron microscope has got 2 million times magnifying capacity. But the original one, R.A.T.S, remains the basis for this. This is the principle. Now that you people have been introduced to the electron microscope, I would like you people to kindly appreciate this diagram. So there is an electron gun, almost similar to the source of light, and that produces the electron beam, which is being reflected by means of the anode. These are all magnetic substances which do prevent the beams going outside, and therefore they get concentrated, just like your objective lens. And there is a condenser lens which helps in helping the beam to pass through the scanning coils, and it falls on the objects and it gets scattered, which is detected by the computer and then recorded. So there is a high voltage electron beam produced by the electron gun fitted with a tungsten filament at the cathode and focused by electromagnetic lenses. So there are lots of lenses that are over here and transmitted to the sample that is there on the stage, which scatters the electrons. This will be the basic principle. In fact, if you people can draw this diagram, if at all a question is asked, I would be happy. As I told you, there are different types. Basically, we will remember two. One is scanning electron microscope, the other is transmission electron microscope. So these are the things. The same principle is very much over there. The anode, the condenser lens, the objective lens, falling on the sample and then scattering the electrons. But then it is limited to the surface. That is what has been mentioned. It has got a low resolution, and the magnification is not as much as you can get in a transmission electron microscope. But the advantage is a large surface or even a three-dimensional structure can be viewed by this. There are different other types of electron microscopy. For example, these are all terminologies which I had managed to gather. I would like you people to kindly know the names alone. HRTEM, High Resonance Transmission Electron Microscope. SSTEM, Serial Section Transmission Electron Microscope. STEM, a combination of scanning and transmission electron microscope. And there is also a provision for coloring by the software. Usually you people would have seen all the electron microscopic pictures are black and white. But then there has been a provision for coloring, and you are able to identify a brain cell, a neuron in this, and there is a synthetic material which offers the background, maybe the glial fibers. And this is one of the modern transmission electron microscopes. Again, go to the net. There is a myriad of information that we people can get, but cannot reproduce in the exam. What are the basic advantages of the electron microscope? It is not in medicine alone. Any large molecule, it can be analyzed and studied. Microorganisms, I shall be showing you a few examples. Biopsy samples, if you are going to see the surface, microvilli for example. Inclusions, various inclusions are there, which again shall be shown. Or if you want to study the crystals, the fibers, amyloid is a classical example, the metals. So in a number of these, you find that electron microscope is useful. Nanotechnology, another one of late. So this is a large one. Please do not say that whether you can have an electron microscope on your table. In fact, you require a room for it. These are the words from Ackerman, the surgical pathology. The latest book will not be giving you. I had taken it from the previous editions, in which he has mentioned electron microscope is of use whenever there is a controversial diagnosis, an inconclusive diagnosis, such as a spindle cell carcinoma, granular cell tumor, histiocytosis X, mesothelioma, carcinoid tumor, small cell carcinoma. These are a few examples that he has given. And other remarks also he has added. The use of the electron microscope itself is diminished with the advent of immunohistochemistry. The electron microscopy can be done with the H&E sections also. And nowadays, however, for the sake of completion, it is mandatory for diagnostic institutes. In countries like the US, there will be various centers which are getting specialized in different technologies. IHC, there is one. Genetics, there is one. Electron microscopy, there is one. But then these have got a very good understanding and transfer of information from one to another. General uses of electron microscope. I would like you people to kindly remember this. This is a very easy list for you people to remember. Very logical, very simple. Surface, as I told you. Surface of the cells, you can see microvilli. Not the villi that you grossly see in the intestine. Microvilli you can see in any cell which is supposed to increase the secretory or the absorptive surface. Desmosomes in between the cells. Processes such as phagocytosis. Basement membrane, thinning or thickening of the basement membrane. Food processes, fusion. Organelles, mitochondria, lysosomes, etc. Various inclusions, glycogen vacuolation. Cytoplasmic granules. Fibers such as asbestos, amyloid, etc. Cilia, the dynemomes. Spirochetes and other microbiological organisms. So this is one list that we shall be remembering. And if at all we are asked a question on electron microscope, this will be fair enough, not complete though. And this is something that we will have to revise, reproduce any number of times. An electronic gun that is producing a beam of electrons, and that is getting focused by means of the condenser lens. And the beam is getting reflected, there is an objective lens. It all falls in the specimen and the electrons are getting scattered. These are picked up by the detector and transferred onto the monitor, recorded in the computer. This we shall be remembering. It is not that you will have to see it and immediately make a diagnosis. What are the limitations of the electron microscope? Please do remember, it is an adjunct. Adjunct means it is an added advantage or a supplement to light microscopy. Small size of the biopsy is a limitation. We cannot have multiple large tissues. The criteria for benign and malignant remain more or less the same as in light microscopy. And just like light microscopy or even IHC, the use is limited in the case of poorly differentiated tumors. And sometimes the histogenesis of poorly differentiated tumors may not be made out. These are the general limitations. Beautiful one again picked up from Ackerman, surgical pathology. Kindly go back to the earlier editions and not to the latest. And some of the applications can be non-neoplastic. Non-neoplastic, of course, you people should remember the entire glomerulopathies, the entire panel of glomerulopathies. There can be thickening and change in morphology as in Alport syndrome. Podocyte fusion, as in the case of a minimal change disease. In some diseases, you find that there can be a thinning. Also, IgA nephropathy and other conditions can be diagnosed by the usage of electron microscopy. Some non-neoplastic conditions, most of which are again restricted to the kidney over here. The use is again being continued. And this is the author. I would like you people to go to the net if you require anything further. Amyloidosis, as mentioned earlier, AL amyloid. Robbins describes it beautifully. Very thin, never branching, and never ending fibers. The IgA nephropathy, amyloid P component also can be seen in that. Lysosomal storage diseases, such as Gaucher's disease. Ciliary defect, Dyne-Nams, microtubules can be seen in cartilaginous syndrome. Glycogen, Pompey's disease in the myocardial fibers. Zebra bodies in the lysosomes in a case of Tay-Sachs disease. And SARS, Ebola viruses can be identified. Some of these are restricted to microbiology. So this is a SARS virus which can be identified over here. Dane particle in a case of hepatitis, spirochetes. All these are other additional uses which you people shall be remembering. I shall be showing you some pictures so that these will get registered in your mind. And the source of reference also I have mentioned, you people can go to them. The Dyne-Nams. So you find that there are multiple pairs of these arms and there is also a central pair. A defect in this will be preventing the synchronous motion of the cilia, as a result of which the patient will be going in for a defective function or even infertility. That will be the Dyne-Nams, and look at the beautiful magnification of it. CADASIL, cerebral autosomal dominant arteriopathy with subarticle infarcts and leukoencephalopathy. Forgive me, I do not know this. But then there is a granular osmophilic material that is found in a patient who has been suffering from migraine headaches. Inflammatory myopathy. So I think you people will be able to appreciate the sarcolemmal fibers over here, the peripheral nucleus, but then there is also an inflammatory lesion over here and a degeneration that has been made out. Sometimes it is difficult to diagnose the various small tumors or the anaplastic tumors. This is a case of a melanoma in which the melanosomes have been picked up by the electron microscope. Blastomal tumors, be it a neuroblastoma or an Ewing's tumor or a Wilms tumor, it is difficult to sometimes make a diagnosis. I'll come to the Ewing's first. Here I find that there is some collection which has been marked as G. So obviously we all know that there will be positivity for glycogen and we used to stain it with PAS. And here again, you find that there can be the blastomal nodules which are present in a case of a Wilms tumor. And this again is the reference. I would like you people to kindly go back to it. There are some applications of non-neoplastic and some of them are dermatological. I would like you people to kindly refer if you need. The peripheral neuropathy, Bugner, this person, he has done a lot of work in the neuropathology, such as demyelination, remyelination of the Schwann cells, so on and so forth. So these are it. Striated muscle disorders, so showing mitochondrial myopathies or Nemelin-Rod myopathy, inflammatory myopathy. All these could be made out. These are some additional applications. So renal application, dermatology, muscle, etc., and storage disorders, we people can comfortably remember. Rhabdomyosarcoma. So you find that there are supposed to be these sarcomeres, rudimentary sarcomeres. Always we find that there will be primitive, immature components which are there in a rhabdomyosarcoma. And the differential diagnosis is supposed to be a amelanotic melanoma. And this can be used to distinguish also the epithelial mesothelioma and an adenocarcinoma. Also, the myofibroblastic and the pleomorphic variants of fibrosarcoma. So these are some of the uses. Endomyositis, myosin and ribosome complexes. So you find that there are the ribosomes and then there will be the endoplasmic reticulum. There can be the complexes of this which can be defective. And this is the storiform pattern that is supposed to be classically distributed by the cells. Malignant fibrous histiocytoma, a pleomorphic fibrosarcoma. So these could be made out. Look at the changes. Even if you people can compare these two pictures, you can appreciate how much of information the electron microscope can give us. The microvilli. Microvilli, all of us know that is there in the intestine. But then, if you are going to find similar kinds of cells in the skin, it means a metastasis of the skin. Renal cell carcinoma, chromophobe, and you find the mitochondria will be displaying microvesicles. What are the advantages and the disadvantages of transmission electron microscopy? Advantages are there is a very powerful magnification and resolution. You can see the clarity that I had shown you. There will be a wide range of applications. It can be scientific, educational, or medical. The images are of a high quality and detail. You will be able to say where exactly the fault is, whether it is in the organelles or in the lysosomal sacs. And it is relatively cheap. I was surprised at reading this particular word because very frequently we ask for a complete panel of IHC markers. And do you know the cost of it? It can run into several thousands for the patient. The disadvantages, however, are the instrument itself is large. It is very expensive and you have to monitor it. There has to be a laborious sample preparation. Special training is definitely required. And the samples must be electron transparent, not light transparent, electron transparent. Very thin section. Generally, we need about 1 micron. Shrinkage and distortion is possible. No three-dimensional aspect can be studied in a transmission electron microscope, whereas in scanning electron microscope, this is possible. And it has to be housed in a special space. There has to be a vacuum covering it. And the images, of course, are black and white, though there is a provision for coloring in a case of scanning. So the list of advantages and disadvantages kindly by heart. Also, I have shown you what are the advantages and disadvantages of the various methods as such. The histology, transmission electron microscopy, RT-PCR. So in each of these, there is a list of advantages and then disadvantages. Histology, for example, you can make a presumptive diagnosis, and only thing is you will not be able to detect a low level of infection. Organisms cannot be seen. It is less expensive. Obviously, it is more expensive, and then there has to be trained pathologists. In a transmission microscopy, you find that there are again advantages and disadvantages. RT-PCR, there can be contamination problems, but it is most sensitive. I would like you people to kindly by heart this also, so that you have an added advantage in your answer. And this also. Though these are all questions and we will be dealing with separately, this particular tabular column, which I had again picked up from the net, will be useful for you people in compilation and comparison. Coming to the electron microscope itself, what can be the various advantages and disadvantages? Here it is. The electron beam, it has got a short wavelength, it has got a very good resolution. The electrons are negatively charged and focused using electromagnets. And objects even 0.1 nanomicrons apart. That is, if there are two components which are seemingly very close to each other, they can be analyzed by means of the electron microscope. It has got a very high resolving power, and the scanning microscope can produce three-dimensional images. Thin sections are not needed for scanning, and color can be added to scanning electron microscope. The disadvantages are the entire specimen must be kept in a vacuum, and thin specimens, accuracy, expertise, complex staining procedure. The images are black and white, flat and two-dimensional. Three-dimensional in TEM can be done, but it is by using serial sections, and it is a cumbersome, very difficult procedure. And scanning electron microscope, though it can produce three-dimensional, it has got a low resolving power. So these are the list of advantages and disadvantages. Again, I would like you people to write, because the question is going to be like this: applications of electron microscope, and this will be part of the answer. What are all the fixatives which can be used in electron microscopy? This is a commonly asked question in the Viva. Even if you get a question in the practicals, you'll have to answer it. Glutaraldehyde, paraformaldehyde, potassium permanganate, vitrification methods, and osmium tetroxide. So these are all the ones, and each one there has got a list of advantages, disadvantages. You can just go through, but I would like you people to kindly remember the fixatives for electron microscope. This again, a beautiful line diagram. I am repeating it for the nth time. Electron gun producing an electron beam being condensed by means of the anode, and it passes as a straight beam, and it is not scattered because of the magnetic lens which is preventing it, and then it passes through the scanning coils. It gets focused onto the object that is placed, and it is sent on to the TV scanner or the computer monitor and recorded. So see, I myself am becoming fluent. I think you people will be able to. If not, see it again. This particular one, it is not for repeating, it is for drawing. So it is a two-dimensional picture, very easy for you to draw. The same list of objectives and lenses are all mentioned. What are all the primary and secondary ones? There is a scattering and there is a detector. It is brought to the circuit, and then it is displayed onto the screen, and there can be a photography. And there is a STEM mode also. STEM means a combination of scanning and transmission electron microscope. I will not go into the analysis of it, and this is the source. Just to impress upon you people that there is another one. All along, you remember the electron gun, it is a source of light. And then finally, there is a detector for the image. Just to show again, what are the different types? Even in the transmission electron microscope, there are two types I have mentioned. These two types alone, I would like you people to kindly mention. One is called a bright field imaging, and then The second one is selected area of electron diffraction. So this is the source of it. I would like you people to kindly mention these two alone. Forget the complexities of this picture. The only way to achieve the impossible is to believe it is possible. Please do remember, we had started from Antony van Leeuwenhoek and his microscope, and we had ended up in the electron microscope. Even in the electron microscope, it is not restricted to medicine alone, but then there is an entire panel of applications. The questions for you people will be scanning electron microscope, transmission electron microscope, application of electron microscopy in renal pathology, in dermatopathology. Also, the advantages and the pitfalls of electron microscopy. What are all the fixatives that could be used? So, a lot can be asked, a lot can be answered, and I'm sure your answers will be excellent after listening to my class and noting down all the display on the screen. Arigato.